Lower Health Care Costs Act. Ta-da! Instead of fighting over subsidies for insurance coverage or who should be required to provide for whom, we've really focused on if we can bring down the cost of health care, maybe the cost of coverage is not going to be so sky high. That's the basis on which we're operating. So there are measures, there's some good transparency pieces, there's some good provisions, some strong provisions in there that will help to reduce the cost of pharmaceuticals. We've been working on an initiative within the bill that would end surprise medical billing. Everybody, you know, has a story about going in for some kind of a procedure. You've done everything that you knew you had to do. You checked to make sure that the hospital was in network. You've checked to make sure your provider was in network. You've done everything that you need to do. Then you go in for the procedure, you wake up afterwards, you're on your way, and 30 days later you get a bill from somebody you didn't even know was in the room, or they sent your labs to a place that wasn't part of the system. Right now, the way the system is set up, if you get that bill, that surprise bill later, it's up to you to navigate it with the provider.
Right.
Right?
Yep.
So you've got to go back and try to figure out how you're going to take care of this. But usually what happens is you're going to pay off some of it and you're going to see if you can't negotiate it out. And it's a headache in the first place, but it's even worse when you're not well. So what we're trying to do is take the patient out of the negotiation. Let that negotiation be between the provider and the insurer. If this was somebody that was out of network, you know, how do I know as the patient? How do I know that?
Right.
I don't. So I don't want to set something up that might work for those in the lower 48, but it sticks us here. So there's a real, sometimes it's a real challenge for us because our costs are higher, we know that. Sometimes absolutely justified, other times it causes you to kind of question, does it really have to be that high? Are there areas that we can work to reduce these costs? Healthcare is the one thing that you go in to purchase that you go in with blinders on. You buy a car, you can see the sticker price. You go fill up your car at the gas station, there's big billboards. You go to the grocery store, you don't just pick any box off the shelf, you're looking at the prices. Healthcare is the one thing that we completely block it off from view and say, hope it works out well for you.